Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be doing urinary tract infections, 50 questions with answers and rationales. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 28-year-old female patient presents to the emergency department with dysuria, suprapubic pain, and cloudy urine. Her urinalysis reveals leukocytes, nitrites, and a high bacterial count. She reports having frequent UTIs and is concerned about antibiotic resistance. Which of the following is the best next nursing intervention? A. Administer trimethoprim sulfamethoxazole as prescribed. B. Educate the patient on increasing fluid intake and cranberry supplementation. C. Collect a urine culture and sensitivity test before initiating antibiotics. D. Teach the patient about proper perineal hygiene to prevent recurrence. Correct answer, C. Rationale: a urine culture and sensitivity test is critical to identify the causative organism and determine antibiotic resistance. Although administering antibiotics, option A, is essential, the culture must be done first. Teaching, options B and D, is important but is not the priority intervention. Question 2. A 72-year-old female patient with diabetes mellitus is admitted with fever, flank pain, and hematuria. Her lab results show elevated WBCs and serum creatinine of 2.4 mg per deciliter. She is diagnosed with pyelonephritis. What complication should the nurse monitor for in this patient? A. Acute respiratory distress syndrome, ARDS. B. Urosepsis. C. Electrolyte imbalances. D. Diabetic ketoacidosis, DKA. Correct answer, B. Rationale: patients with pyelonephritis, particularly those with diabetes, are at a high risk for urosepsis, a life-threatening complication. While options A, C, and D may be relevant in other conditions, they are less specific to this clinical scenario. Question 3. A 35-year-old pregnant woman at 26 weeks gestation presents with dysuria and urgency. Urinalysis reveals significant bacteriuria. She denies fever or flank pain. What is the priority nursing action? A. Start empiric antibiotics immediately. B. Inform the patient that asymptomatic bacteriuria does not require treatment during pregnancy. C. Obtain a urine culture and initiate antibiotics after obtaining results. D. Schedule a follow-up renal ultrasound to monitor for pyelonephritis. Correct answer, C. Rationale: asymptomatic bacteriuria in pregnancy should be treated due to the risk of complications like pyelonephritis and preterm labor. A urine culture must be obtained before starting antibiotics to guide therapy. Empiric antibiotics, option A, may be used but should follow the culture. Question 4. A 60-year-old male patient with a history of benign prostatic hyperplasia, BPH, is admitted with urinary retention and a UTI. The patient reports chills, dysuria, and weak urinary stream. Which intervention should the nurse prioritize? A. Insert an indwelling catheter to relieve retention. B. Administer antipyretics for fever. C. Begin 4 antibiotics immediately. D. Encourage frequent voiding and increase fluid intake. Correct answer, A. Rationale: relieving urinary retention is the priority to prevent further complications like hydronephrosis or worsening infection. While antibiotics, option C, are essential, addressing the mechanical obstruction is more urgent. Fever control and hydration, options B and D, are secondary. Question 5. A 45-year-old female with recurrent UTIs presents with fever, costovertebral angle tenderness, and malaise. Blood cultures reveal Escherichia coli. What additional assessment finding would indicate the need for immediate intervention? A. Blood pressure of 110/70 mm of mercury. B. Heart rate of 102. C. Respiratory rate of 28 breaths per minute. D. White blood cell count of 12,000. Correct answer, C. Rationale: a respiratory rate of 28 breaths per minute suggests systemic involvement, potentially progressing to sepsis. While tachycardia, option B, and elevated WBCs, option D, are expected findings, the respiratory changes are most concerning and require immediate attention. Question 6. A 32-year-old female patient with a history of interstitial cystitis presents with complaints of pelvic pain and frequent urination. Which intervention should the nurse implement first? A. Educate the patient about bladder training techniques. B. Administer prescribed phenazopyridine for pain relief. C. Obtain a urine sample for culture and sensitivity. D. Encourage the patient to avoid irritants like caffeine and alcohol. Correct answer, C. Rationale: while bladder training and dietary changes, options A and D, are important for managing interstitial cystitis, ruling out infection through a urine culture is the priority. Phenazopyridine, option B, is for symptom relief but does not address the underlying issue. Question 7. A patient with a history of renal calculi presents with symptoms of a UTI, including dysuria and fever. A CT scan shows a 5 mm stone in the ureter. What is the most important nursing intervention? A. Administer pain medication as prescribed. B. Encourage the patient to drink 3 to 4 liters of water daily. C. Monitor for signs of urinary obstruction. D. Prepare the patient for lithotripsy. Correct answer, C. Rationale: the presence of a stone increases the risk of obstruction, which can lead to hydronephrosis or urosepsis. While hydration, option B, and lithotripsy, option D, are important, monitoring for obstruction is critical in this acute phase. Question 8. A 50-year-old female patient presents with a catheter-associated urinary tract infection, UTI. What is the nurse's priority intervention to reduce recurrence? A. Replace the indwelling catheter every 2 weeks. B. Ensure a septic technique during catheter insertion. C. Administer prophylactic antibiotics with catheter use. D. Encourage the patient to void frequently. Correct answer, B. Rationale: a septic technique during catheter insertion is the most effective way to prevent UTI. Replacing catheters, option A, routinely is unnecessary. Antibiotics, option C, are not routinely given prophylactically to catheterized patients. Question 9. A 65-year-old male patient with prostate cancer is receiving chemotherapy and develops a UTI. Which lab value would most concern the nurse? A. Hemoglobin of 13 grams per deciliter. B. Absolute neutrophil count of 450. C. Platelet count of 150,000. D. Serum creatinine of 1.2 mg per deciliter. Correct answer, B. Rationale: an absolute neutrophil count of 450 indicates neutropenia, placing the patient at high risk for sepsis. Monitoring infection closely is essential. The other lab values are within acceptable limits or unrelated to the UTI. Question 10. A 30-year-old female with a history of lupus presents with dysuria and hematuria. She is prescribed corticosteroids for lupus nephritis. What is the nurse's priority assessment? A. Monitor for signs of hyperglycemia. B. Assess for flank pain and fever. C. Evaluate for signs of immunosuppression. D. Check for medication compliance. Correct answer, C. Rationale: corticosteroid use increases the risk of immunosuppression, which may lead to severe infections like pyelonephritis. While other assessments are important, recognizing and addressing immunosuppression is a priority. Question 11. A 40-year-old male presents with fever, dysuria, and purulent urethral discharge. He reports a recent history of unprotected sexual activity. A urinalysis reveals leukocyturia and a positive culture for Neisseria gonorrhoeae. What is the nurse's priority intervention? A. Educate the patient on safe sexual practices to prevent reinfection. B. Administer the prescribed dual therapy of ceftriaxone and azithromycin. C. Obtain a detailed sexual history and notify recent partners. D. Encourage the patient to increase fluid intake. Correct answer, B. Rationale: the immediate priority is to administer the prescribed antibiotics to treat the infection effectively. While educating the patient, option A, and notifying partners, option C, are important for public health, treatment of the infection takes precedence. Fluid intake, option D, is supportive but not the priority. Question 12. A 25-year-old female is hospitalized for a complicated UTI with extended spectrum beta-lactamase, ESBL, producing E. coli. The physician orders ertapenem IV. What is the most important nursing action before initiating the therapy? A. Educate the patient about the risk of antibiotic resistance. B. Confirm the patient has no allergy to carbapenems. C. Ensure that the patient's IV access is patent. D. Verify the dose and infusion rate with the pharmacist. Correct answer, B. Rationale: confirming the patient's allergy status is critical to avoid an anaphylactic reaction. Ensuring IV patency, option C, and verifying the dose, option D, are important steps but come after confirming allergy status. Educating the patient, option A, is necessary but not the priority in this scenario. Question 13. A 68-year-old male with a history of chronic urinary retention due to neurogenic bladder presents with fever, chills, and hypotension. Blood cultures confirm urosepsis. Which of the following findings indicates worsening sepsis? A. Blood pressure of 110/70 mm of mercury. B. Serum lactate level of 5 millimoles per liter. C. Temperature of 37.8 degrees Celsius, 100 degrees Fahrenheit. D. Heart rate of 95. Correct answer, B. Rationale: a serum lactate level above 4 millimoles per liter is a strong indicator of severe sepsis and poor tissue perfusion. The other findings are not as indicative of progression to septic shock. Question 14. A 45-year-old female patient with recurrent UTIs is prescribed prophylactic nitrofurantoin. During a follow-up visit, she reports new-onset dyspnea and non-productive cough. What is the priority nursing action? A. Educate the patient to stop taking nitrofurantoin immediately. B. Monitor the patient's oxygen saturation levels. C. Notify the healthcare provider of potential pulmonary toxicity. D. Encourage the patient to drink more water to dilute urine. Correct answer, B. Rationale: new-onset dyspnea and cough in a patient taking nitrofurantoin could indicate pulmonary toxicity, a rare but serious side effect. Monitoring oxygen saturation is the priority to assess for impaired gas exchange and hypoxemia. Notifying the provider, option C, and stopping the medication, option A, are essential, but follow after assessing oxygenation. Encouraging hydration, option D, is not relevant to the primary concern in this situation. Question 15. A 33-year-old postpartum patient with a Foley catheter reports dysuria and suprapubic pain. The nurse notes cloudy urine in the catheter bag. What is the priority nursing action? A. Remove the Foley catheter immediately. B. Collect a sterile urine sample from the catheter for analysis. C. Administer the prescribed antibiotics. D. Encourage early ambulation to improve bladder function. Correct answer, B. Rationale: collecting a sterile urine sample is essential to identify the pathogen before initiating antibiotics. Removing the catheter, option A, may be needed later but not before collecting a sample. Ambulation, option D, is not relevant at this point. Question 16. A 22-year-old female presents with her third UTI in 6 months. She reports using spermicides as her primary form of contraception. What is the most important patient education topic for this patient? A. Avoid using spermicides as they can increase UTI risk. B. Increase fluid intake to at least 2 liters per day. C. Consider cranberry supplements to reduce recurrence. D. Practice proper perineal hygiene after sexual activity. Correct answer, A. Rationale: spermicides disrupt the vaginal flora, increasing UTI risk. While other measures like hydration, option B, and hygiene, option D, are helpful, avoiding spermicides is most relevant in this case. Question 17. A patient undergoing chemotherapy for bladder cancer develops a UTI. The nurse notes mucositis and low white blood cell counts on the patient's labs. Which intervention should the nurse prioritize? A. Administer prescribed antibiotics immediately. B. Monitor the patient for signs of renal failure. C. Encourage the patient to drink plenty of fluids. D. Perform perineal care to reduce infection risk. Correct answer, A. Rationale: chemotherapy patients with neutropenia are at high risk for sepsis from a UTI. Prompt administration of antibiotics is critical. Monitoring for renal failure, option B, and maintaining hygiene, option D, are supportive but secondary interventions. Question 18. A 54-year-old male presents with fever, dysuria, and perineal pain. His PSA is elevated, and a digital rectal exam reveals an enlarged, tender prostate. What intervention should the nurse question? A. Administer prescribed antibiotics. B. Insert a Foley catheter for urinary retention. C. Encourage the patient to increase oral fluid intake. D. Teach the patient about sitz baths for comfort. Correct answer, B. Rationale: inserting a Foley catheter is contraindicated in acute bacterial prostatitis due to the risk of spreading infection. Antibiotics, option A, and supportive measures like sitz baths, option D, are appropriate interventions. Question 19. A 19-year-old college student is diagnosed with an uncomplicated UTI. The patient reports being sexually active with multiple partners. Which diagnostic test is most important to include in the plan of care? A. Urine culture and sensitivity. B. Renal ultrasound to rule out pyelonephritis. C. Testing for sexually transmitted infections, STIs. D. Serum creatinine to assess renal function. Correct answer, C. Rationale: given the patient's history of multiple sexual partners, STIs should be ruled out as a potential cause of symptoms. While a urine culture, option A, is also important, STI testing takes priority due to the clinical history. Question 20. A 67-year-old female presents with a UTI and confusion. She has a history of dementia and incontinence. What is the best nursing intervention to prevent future UTIs in this patient? A. Educate the family about perineal care. B. Limit the use of incontinence briefs. C. Encourage fluid intake of at least 1.5 liters per day. D. Perform bladder scans to monitor post-void residual. Correct answer, A. Rationale: education about proper perineal care is critical for preventing UTIs in patients with incontinence. While other interventions like limiting incontinence briefs, option B, and encouraging hydration, option C, are helpful, hygiene education is most effective for prevention. Question 21. A 62-year-old male with a history of benign prostatic hyperplasia, BPH, is hospitalized for a recurrent UTI. He complains of nocturia, urgency, and incomplete bladder emptying. The healthcare provider orders a post-void residual, PVR, assessment. Which finding indicates the need for further intervention? A. PVR of 50 milliliters. B. PVR of 120 milliliters. C. PVR of 300 milliliters. D. PVR of 200 milliliters. Correct answer, C. Rationale: a PVR of 300 milliliters suggests significant urinary retention, increasing the risk of infection and kidney damage. While 120 milliliters, option B, and 200 milliliters, option D, are elevated, 300 milliliters warrants immediate intervention. A PVR of 50 milliliters, option A, is normal. Question 22. A 50-year-old female with a history of urinary incontinence and recurrent UTIs presents with dysuria and foul-smelling urine. Her urinalysis reveals significant bacteriuria. What lifestyle modification should the nurse prioritize in patient education to prevent recurrence? A. Encourage the use of vaginal douches for hygiene. B. Advise the patient to void immediately after sexual activity. C. Recommend the routine use of prophylactic antibiotics. D. Suggest limiting fluid intake to reduce incontinence episodes. Correct answer, B. Rationale: voiding after sexual activity helps flush bacteria from the urethra, reducing the risk of recurrent UTIs. Vaginal douches, option A, can disrupt normal flora and are not recommended. Prophylactic antibiotics, option C, are not the first-line approach, and limiting fluids, option D, can worsen UTIs. Question 23. A 70-year-old male patient with an indwelling urinary catheter develops fever and chills. His urinalysis shows positive leukocyte esterase and nitrites. What is the nurse's best action? A. Replace the urinary catheter and obtain a urine culture. B. Administer prescribed antipyretics to control the fever. C. Encourage the patient to increase oral fluid intake. D. Remove the urinary catheter and avoid reinsertion. Correct answer, A. Rationale: in catheter-associated urinary tract infections, CAUTIs, replacing the catheter and obtaining a culture are necessary to identify the pathogen and prevent reinfection. Removing the catheter without replacement, option D, is not feasible for patients requiring catheterization. Question 24. A 38-year-old female presents with symptoms of a UTI. She reports severe flank pain, fever, and nausea. A CT scan confirms pyelonephritis, which finding would indicate that the condition is progressing to septic shock. A. Heart rate of 88 beats per minute. B. Urine output of 15 milliliters per hour. C. Blood pressure of 125/80 millimeters of mercury. D. Serum creatinine of 1 milligrams per deciliter. Correct answer, B. Rationale: oliguria, urine output less than 30 milliliters per hour, is a sign of organ dysfunction and may indicate progression to septic shock. The other findings are within normal limits or less concerning in this context. Question 25. A 29-year-old female with type 1 diabetes presents with dysuria, ketonuria, and elevated blood glucose levels. What is the nurse's priority assessment? A. Assess for signs of urosepsis. B. Monitor for signs of diabetic ketoacidosis, DKA. C. Perform a detailed dietary history. D. Evaluate the patient's hydration status. Correct answer, B. Rationale: in patients with type 1 diabetes, a UTI can precipitate diabetic ketoacidosis, DKA, a life-threatening condition. While urosepsis, option A, is a concern, DKA is a more immediate threat in this scenario. Question 26. A 75-year-old male patient with Parkinson's disease presents with a UTI. He has a history of difficulty voiding due to poor bladder tone. What is the nurse's best intervention to reduce the risk of future infections? A. Educate the patient on double voiding techniques. B. Encourage the patient to drink 1 liter of fluid daily. C. Insert a Foley catheter to facilitate voiding. D. Recommend the use of intermittent catheterization. Correct answer, D. Rationale: intermittent catheterization is the preferred method for managing chronic urinary retention and reducing the risk of infection. Double voiding, option A, may help but is less effective. Foley catheters, option C, are not ideal for long-term use. Question 27. A 55-year-old postmenopausal woman with a history of recurrent UTIs reports vaginal dryness and dysuria. What treatment would the nurse anticipate being prescribed to address the underlying cause? A. Topical estrogen cream. B. Oral fluconazole. C. Nitrofurantoin prophylaxis. D. Increased cranberry juice intake. Correct answer, A. Rationale: vaginal dryness in postmenopausal women can lead to recurrent UTIs due to decreased estrogen levels. Topical estrogen cream helps restore the vaginal flora and reduce infection risk. Options B and C are not addressing the underlying cause. Question 28. A 64-year-old male presents with fever, dysuria, and urinary retention. He has a history of chronic prostatitis. What diagnostic test should the nurse anticipate to confirm the diagnosis? A. Digital rectal examination, DRE. B. Post-void residual, PVR, assessment. C. Transrectal ultrasound, TRUS. D. Urine culture and sensitivity. Correct answer, D. Rationale: a urine culture is essential to identify the causative organism and guide treatment. While DRE, option A, and TRUS, option C, may assist in diagnosing prostatitis, they do not confirm the infectious etiology. Question 29. A 36-year-old pregnant woman at 30 weeks gestation presents with a UTI and reports chills and flank pain. The healthcare provider prescribes ceftriaxone IV. What is the nurse's priority assessment before administering the medication? A. Check for a history of penicillin allergy. B. Assess the patient's renal function. C. Monitor fetal heart rate. D. Obtain a baseline temperature. Correct answer, A. Rationale: cross-reactivity between penicillins and cephalosporins can occur. Assessing for a penicillin allergy is critical before administering ceftriaxone. Renal function and fetal heart rate, options B and C, are also important but are not the immediate priority. Question 30. A 42-year-old female presents with recurrent UTIs. She reports using diaphragm contraception. What education should the nurse provide to reduce the risk of future infections? A. Avoid using diaphragms and switch to another form of contraception. B. Increase daily water intake to at least 3 liters. C. Use vaginal douches after intercourse. D. Take prophylactic antibiotics before sexual activity. Correct answer, A. Rationale: diaphragm use is associated with increased UTI risk due to urinary stasis. Switching contraception methods is the best preventive strategy. Vaginal douches, option C, are not recommended as they disrupt the vaginal flora. Question 31. A 68-year-old female with a history of chronic kidney disease, CKD, presents with fever, dysuria, and flank pain. Her serum creatinine is 3.0 mg per deciliter, and urinalysis shows significant bacteriuria. The healthcare provider prescribes levofloxacin. What is the priority nursing action before administering the medication? A. Assess the patient for allergies to fluoroquinolones. B. Verify renal dosing adjustments with the pharmacist. C. Collect a urine culture before administering the antibiotic. D. Educate the patient about possible tendon rupture. Correct answer, B. Rationale: in patients with CKD, antibiotic dosages often require adjustment to prevent toxicity. While assessing allergies, option A, and obtaining a urine culture, option C, are important, verifying renal dosing adjustments is the immediate priority. Educating about tendon rupture, option D, is important but secondary. Question 32. A 24-year-old female presents with her second UTI in 3 months. She reports frequent sexual activity and uses bubble baths regularly. What should the nurse emphasize during patient education? A. Avoid bubble baths and scented personal hygiene products. B. Increase water intake to 1 liter per day. C. Use cranberry juice or supplements daily. D. Take over-the-counter probiotics regularly. Correct answer, A. Rationale: bubble baths and scented products can irritate the urethra, increasing the risk of UTIs. While hydration, option B, and probiotics, option D, may help, eliminating irritants is the most effective prevention strategy. Question 33. A 75-year-old male presents with fever, dysuria, and confusion. He has a Foley catheter in place due to a recent surgery. His urinalysis is positive for leukocytes and nitrites. What is the priority intervention for this patient? A. Replace the Foley catheter with a sterile one. B. Administer antipyretics to reduce fever. C. Monitor for signs of urosepsis. D. Encourage the patient to drink more fluids. Correct answer, A. Rationale: replacing the Foley catheter reduces the bacterial load and prevents further contamination. Monitoring for urosepsis, option C, is critical but follows catheter replacement. Fever management and hydration, options B and D, are supportive but not priorities. Question 34. A 58-year-old male with diabetes presents with fever, dysuria, and severe flank pain. His blood glucose is 450 mg per deciliter, and urinalysis shows ketones and bacteriuria. What complication should the nurse monitor for? A. Diabetic ketoacidosis, DKA. B. Acute kidney injury, AKI. C. Urosepsis. D. Pyelonephritis. Correct answer, C. Rationale: diabetic patients with UTIs are at high risk for developing urosepsis, especially with uncontrolled blood glucose. While DKA, option A, and pyelonephritis, option D, are concerns, urosepsis is the most life-threatening complication to monitor. Question 35. A 49-year-old female with recurrent UTIs reports persistent dysuria despite completing her prescribed antibiotic course. A follow-up urinalysis shows no bacteria but significant leukocytes. What is the next best step in managing this patient? A. Refer the patient to a urologist for further evaluation. B. Prescribe another round of antibiotics. C. Recommend increased fluid intake and cranberry supplements. D. Educate the patient about interstitial cystitis. Correct answer, A. Rationale: persistent dysuria with no bacterial evidence warrants further evaluation by a urologist to rule out conditions like interstitial cystitis or structural abnormalities. Prescribing antibiotics, option B, without identifying the cause is inappropriate. Question 36. A 73-year-old female with a history of osteoporosis presents with a UTI. The healthcare provider prescribes ciprofloxacin. What adverse effect is the nurse most concerned about for this patient? A. Photosensitivity. B. Nausea and vomiting. C. Tendon rupture. D. Peripheral neuropathy. Correct answer, C. Rationale: older adults and those with osteoporosis are at an increased risk of tendon rupture with fluoroquinolones like ciprofloxacin. While options A, B, and D are potential side effects, tendon rupture is the most serious concern in this patient population. Question 37. A 35-year-old female presents with fever, dysuria, and hematuria. She is diagnosed with a UTI and started on trimethoprim sulfamethoxazole. After 2 doses, she develops a rash and complains of itching. What is the nurse's priority action? A. Discontinue the medication and notify the provider. B. Administer diphenhydramine for the allergic reaction. C. Monitor the patient for signs of anaphylaxis. D. Educate the patient to avoid sunlight while on the medication. Correct answer, A. Rationale: the medication should be discontinued immediately if an allergic reaction occurs. Monitoring for anaphylaxis, option C, and treating symptoms, option B, are important but secondary. Sunlight precautions, option D, are not relevant in this case. Question 38. A 40-year-old female presents with recurrent UTIs and is found to have vesicoureteral reflux on imaging. What intervention should the nurse anticipate? A. Long-term prophylactic antibiotics. B. Immediate surgical correction. C. Increased fluid intake to flush bacteria. D. Routine bladder scans to monitor residual urine. Correct answer, A. Rationale: long-term prophylactic antibiotics are often used to prevent recurrent UTIs in patients with vesicoureteral reflux. Surgery, option B, may be considered for severe cases, but it is not the first-line treatment. Question 39. A 48-year-old male presents with dysuria and pelvic pain. His digital rectal exam reveals an enlarged, tender prostate. He is diagnosed with acute bacterial prostatitis. What is the most important teaching point for the patient? A. Complete the entire course of antibiotics as prescribed. B. Avoid sitting for long periods to reduce discomfort. C. Use warm compresses to relieve pain. D. Avoid sexual activity until symptoms resolve. Correct answer, A. Rationale: completing the entire antibiotic course is critical to ensure eradication of the infection and prevent recurrence. While options B, C, and D are helpful for symptom management, they are not as critical as completing the prescribed treatment. Question 40. A 60-year-old female with recurrent UTIs presents with fever, flank pain, and confusion. Her blood pressure is 88/60 millimeters of mercury, and heart rate is 110 beats per minute. What is the priority nursing action? A. Administer IV fluids to stabilize blood pressure. B. Obtain a urine culture and sensitivity. C. Start empiric broad-spectrum antibiotics. D. Monitor the patient's urine output hourly. Correct answer, A. Rationale: the patient's low blood pressure and tachycardia indicate septic shock. Stabilizing blood pressure with IV fluids is the priority intervention to restore perfusion. Antibiotics, option C, and cultures, option B, are important but come after fluid resuscitation. Question 41. A 67-year-old male with a history of urinary retention presents with fever, flank pain, and dysuria. A bladder ultrasound reveals 500 milliliters of urine retained post-void. What is the nurse's priority intervention? A. Insert a Foley catheter to relieve retention. B. Administer the prescribed IV antibiotics. C. Encourage the patient to attempt double voiding. D. Monitor for signs of acute kidney injury, AKI. Correct answer, A. Rationale: relieving urinary retention is the priority to prevent complications such as hydronephrosis and worsening infection. Administering antibiotics, option B, is essential but follows the resolution of the retention. Double voiding, option C, is not effective in this situation, and monitoring for AKI, option D, is secondary. Question 42. A 30-year-old female presents with dysuria and pelvic pain. She has a history of recurrent UTIs and reports recent antibiotic use. A urine culture reveals Candida albicans. What is the nurse's priority intervention? A. Administer the prescribed antifungal medication. B. Educate the patient about reducing sugar intake. C. Encourage the patient to increase fluid intake. D. Obtain a repeat urine culture in 48 hours. Correct answer, A. Rationale: fungal infections such as Candida albicans are common after recent antibiotic use. The priority is administering antifungal treatment. While reducing sugar intake, option B, and increasing fluids, option C, are supportive measures, they are not the primary intervention. Question 43. A 58-year-old male presents with fever, dysuria, and difficulty voiding. His urinalysis reveals leukocyturia and significant bacteriuria. A prostate-specific antigen (PSA) test is elevated. What is the nurse's next best action? A. Educate the patient about prostate cancer screening. B. Collect a urine culture and initiate prescribed antibiotics. C. Encourage the patient to drink more water. D. Prepare the patient for a biopsy to confirm prostate cancer. Correct answer, B. Rationale: the priority in this situation is treating the infection. Elevated PSA may be due to prostatitis, and further cancer screening is not immediately necessary. Educating about cancer screening, option A, and hydration, option C, are secondary measures. Question 44. A 35-year-old female presents with persistent dysuria and hematuria despite completing antibiotics for a UTI. Imaging reveals no abnormalities, and cystoscopy is ordered. What condition is the healthcare provider likely suspecting? A. Pyelonephritis. B. Interstitial cystitis. C. Bladder cancer. D. Vesicoureteral reflux. Correct answer, B. Rationale: interstitial cystitis, a chronic bladder condition, is suspected when UTI symptoms persist despite antibiotic treatment and no structural abnormalities are identified. Pyelonephritis, option A, and bladder cancer, option C, typically present with different findings. Question 45. A 75-year-old female with dementia is admitted for a UTI. She becomes increasingly agitated and disoriented during the night. What is the nurse's best intervention? A. Administer the prescribed antipyretic to reduce fever. B. Monitor the patient for signs of delirium. C. Encourage the family to stay with the patient for reassurance. D. Reduce nighttime noise and provide a calming environment. Correct answer, B. Rationale: older adults with UTIs are at risk for delirium, which must be closely monitored. While reducing noise, option D, and involving family, option C, can be helpful, identifying and managing delirium is the priority. Question 46. A 52-year-old female presents with recurrent UTIs. Imaging shows multiple kidney stones, composed of struvite. What is the primary treatment goal for this patient? A. Increase oral hydration to prevent stone formation. B. Administer antibiotics to treat the underlying infection. C. Recommend dietary changes to reduce calcium intake. D. Schedule the patient for lithotripsy. Correct answer, B. Rationale: struvite stones are often caused by infection with urease-producing bacteria. Treating the infection with antibiotics is the primary goal. Increasing hydration, option A, and lithotripsy, option D, are secondary measures. Question 47. A 70-year-old male with a Foley catheter presents with a new fever and cloudy urine. His urinalysis shows leukocytes and nitrites. What finding would indicate the infection is progressing to sepsis? A. Blood pressure of 95/60 mm of mercury. B. Respiratory rate of 18 breaths per minute. C. White blood cell count of 8,000. D. Urine output of 40 milliliters per hour. Correct answer, A. Rationale: hypotension is an early sign of sepsis. While other findings like respiratory rate, option B, and urine output, option D, are within normal limits, a drop in blood pressure requires immediate attention. Question 48. A 26-year-old female with diabetes presents with dysuria and ketonuria. She is diagnosed with a UTI and started on antibiotics. Which additional intervention is most important for this patient? A. Monitor blood glucose levels closely. B. Encourage increased fluid intake. C. Provide education about proper perineal hygiene. D. Recommend probiotics to prevent antibiotic-associated diarrhea. Correct answer, A. Rationale: UTIs can cause blood glucose levels to become unstable in diabetic patients. Monitoring and managing glucose levels are critical. Other interventions, options B, C, and D, are supportive but not the priority. Question 49. A 45-year-old male with a history of spinal cord injury presents with fever, dysuria, and foul-smelling urine. He has an indwelling urinary catheter and is diagnosed with a UTI. What is the nurse's priority intervention? A. Replace the catheter and obtain a urine culture. B. Administer the prescribed antibiotics. C. Monitor for signs of autonomic dysreflexia. D. Encourage the patient to drink plenty of fluids. Correct answer, A. Rationale: replacing the catheter and obtaining a culture are essential to identify the pathogen and reduce bacterial load. Monitoring for autonomic dysreflexia, option C, is important but secondary. Antibiotics, option B, follow these initial steps. Question 50. A 63-year-old female presents with a UTI and reports chills, fatigue, and flank pain. Her blood pressure is 85/55 mm of mercury, and her heart rate is 120 beats per minute. What is the priority nursing intervention? A. Begin IV fluid resuscitation immediately. B. Obtain blood cultures before starting antibiotics. C. Administer prescribed broad-spectrum antibiotics. D. Monitor the patient's urine output every hour. Correct answer, A. Rationale: the patient's hypotension and tachycardia indicate septic shock. Immediate IV fluid resuscitation is critical to restore perfusion. Blood cultures and antibiotics, options B and C, follow stabilization. Monitoring urine output, option D, is important but not the priority.